Hello everyone, my name is Nina Mirza, and in this presentation, I will discuss a global health policy issue related to pediatric vision screening and follow-up care. While vision screening programs exist in many countries, including the United States, a significant number of children who fill these screenings never receive the treatment they need. The issue is important because untreated vision problems can affect children's ability to learn, participate in school, and reach their full potential. Vision care is not only a health issue, but also an educational and economic one. In this presentation, I will examine the scale of pediatric vision impairment, review the current policy landscape, and discuss policy solutions that could improve follow-up care after screenings. Addressing these gaps can contribute to better health outcomes and support the goals of Sustainable Development Goal 3, which focuses on ensuring healthy lives and promoting well-being for all. Vision problems are among the most common health issues affecting school-aged children. In many cases, children may not realize they have a vision problem because they assume everyone sees the same way they do. As a result, vision impairments often go undetected unless screening programs are in place. Schools frequently conduct vision screenings to identify students who may have difficulty seeing clearly. However, identifying the problem is only the first step. The larger issue arises when children who fail these screenings do not receive follow-up eye examinations or corrective treatment. This gap between screening and treatment represents a major weakness in many vision care systems. Without proper follow-up care, children may struggle with reading, writing, and other classroom tasks. Over time, this can lead to academic challenges, reduced confidence, and missed educational opportunities. Because early childhood development is a critical period for learning, untreated vision problems can have long-term consequences. Vision health is closely connected to several broader public health outcomes. First, children who cannot see clearly may have difficulty participating fully in classroom activities. Reading comprehension, concentration, and engagement in school can all be affected by poor vision. Second, vision problems can influence social and emotional development. Children who struggle academically because of untreated vision issues may become discouraged or disengaged from school. Over time, these challenges can affect educational attainment and career opportunities later in life. Another important public health consideration is health equity. Children from low-income families often face greater barriers to receiving eye care. These barriers may include lack of insurance coverage, transportation difficulties, or limited access to eye care providers. Because of these structural barriers, children in disadvantaged communities are more likely to experience untreated vision problems. For these reasons, improving access to pediatric vision care is not only a clinical issue, but also a matter of promoting fairness and equal opportunity. From an epidemiological perspective, vision impairment represents a significant global health burden. According to data from the World Health Organization, hundreds of millions of people worldwide live with some form of vision impairment, and many of these cases are preventable or treatable. Among children, uncorrected refractive errors are one of the leading causes of vision problems. These conditions occur when the eye cannot properly focus light, making objects appear blurry. Fortunately, refractive errors are often easily corrected with prescription glasses or other treatments. Despite the availability of effective treatments, many children remain untreated. This is particularly true in low and middle-income countries, where access to eye care services may be limited. However, even in high-income countries, gaps in follow-up care can prevent children from receiving the help they need. These epidemiological findings highlight the importance of early detection and intervention. Screening programs are valuable tools, but they must be connected to systems that ensure children receive proper treatment. In many regions, Governments and public health organizations have recognized the importance of vision screening for children. Some countries require schools to conduct vision screenings at certain grade levels in order to identify potential vision problems early. International organizations, including the World Health Organization, have also emphasized the importance of addressing avoidable vision impairment. Initiatives focused on preventing blindness and improving eye health have become part of broader global health strategies. However, despite these efforts, the policies surrounding pediatric vision screening are often fragmented. Different countries and even different states within the same country may have varying requirements and resources for screening programs. Some areas have well-organized programs with strong follow-up systems, while others lack the infrastructure necessary to connect children to treatment. Because of these inconsistencies, many children fall through the cracks after initial screenings. Several policy gaps contribute to the challenges associated with pediatric vision screening programs. One major gap is the lack of referral tracking systems. When a child fails a screening, schools may notify parents, but there is often no system in place to track whether the child actually receives an eye examination. Another challenge is limited coordination between schools and healthcare providers. Schools may identify potential vision problems, but they do not always have the resources or partnerships needed to connect families with eye care professionals. Financial barriers also play a role. Even though corrective treatments such as eyeglasses are relatively affordable, the cost of eye exams and other services can still be a barrier for some families. Addressing these policy gaps requires coordinated efforts across education systems, healthcare systems, and public health agencies. From an economic perspective, investing in pediatric vision care is highly cost-effective. Early detection and treatment of vision problems can prevent more serious complications later in life. In many cases, a simple pair of glasses can dramatically improve a child's ability to learn and participate in school. The economic benefits extend beyond individual health outcomes. When children receive the care they need, they are more likely to succeed academically and eventually contribute to the workforce. This can have positive long-term effects on economic productivity. Research has shown that the cost of implementing screening programs and providing basic treatments is relatively low compared to the potential social and economic benefits. For policymakers, this makes pediatric vision care an attractive area for investment within public health systems. In addition to economic and epidemiological considerations, ethical principles also support stronger pediatric vision care policies. One important ethical principle is equity. Every child should have access to basic healthcare services, including vision care, regardless of their socioeconomic background. Another ethical consideration involves responsibility. When schools conduct vision screenings and identify potential health problems, there is an implicit responsibility to ensure that children receive appropriate care. Screening without follow-up treatment may create a false sense of security without actually improving health outcomes. Public health policies should aim to reduce disparities in access to care and ensure that vulnerable populations are not left behind. If these policy strategies are successfully implemented, the potential benefits could be significant. Improved follow-up care after screenings would allow more children to receive timely treatment for vision problems. This could lead to better academic performance, improved quality of life, and greater educational opportunities for affected children. Over time, stronger pediatric vision care systems could also reduce health disparities and support broader public health goals. Because vision problems are often preventable or treatable, relatively small policy changes can have a meaningful impact on children's lives. In conclusion, pediatric vision screening programs are valuable tools for identifying vision problems in children. However, their effectiveness depends on the systems that connect screenings to treatment. By strengthening referral tracking systems, expanding partnerships between schools and healthcare providers, and improving access to eye care services, policymakers can ensure that more children receive the care they need. Addressing pediatric vision impairment supports broader public health goals, including improving educational outcomes and advancing health equity. Ultimately, ensuring that children can see clearly is a simple yet powerful step toward improving both health and opportunity. And finally, to support this policy brief, I drew on several sources from global health and public health policy literature. Key sources include the World Health Organization's World Report on Vision, which provides global data on vision impairment, and the United Nations Sustainable Development Goals framework, particularly SDG 3, focused on health and well-being. I also used the Global Health Advocacy Guide from the University of California Global Health Institute and materials from the American Public Health Association that discuss effective public health advocacy strategies. These sources help provide both the epidemiological evidence and the policy framework used to develop the recommendations presented in this research brief. Thank you guys all so much for listening, and I hope you guys all enjoyed this presentation.